Good morning, everybody, and welcome to 2021. So I'm excited to start the year with you guys. So welcome and thank you for joining us today for the meeting of New York City Health and Hospital Audit Committee. Today's meeting is officially called to order. One notation that I want to make sure everybody's aware, there is one small edit that we have to make to our minutes of 10:08. It shows that Frida Wang was in attendance and she was not present during that meeting. So I would like to propose a motion to adopt the amended minutes showing that Frida Wang was not in attendance for the audit committee meeting held on October 8th, 2020.
Second.
Thank you.
Who second, please?
Jose Pagan.
So
Thank
now
you.
I'm going to poll each member for his or her vote. Dr. Pagan,
Yes.
Dr. Katz,
Yes.
Benny Peña Mora,
Yes.
and Sally Pinero.
Yes.
Ready? Everybody approved. Minutes are passed. So next on our agenda will be the presentation of Grant Norton on our June 30th, 2020 management letter. Jay, would you like to present the team from Grant Norton? Jay?
So this is Jay Wyman, Corporate Controller. I'm going to turn this over to Tammy Rudinsky from Grant Thornton for the presentation.
Great. Thank you, Jane. Good morning, everybody. I'm Tammy Rudinsky. I'm the audit partner from Grant Thornton. And with me today, I have part of my team. I have Lou Fierstein, DeGuardi, and then Sandy Pablo, who's representing our information technology group. So first of all, Happy New Year to everybody. Hope everyone is safe and healthy. I really want to thank, Dr. Katz and the entire HHC team and Helen for their leadership, not only with this audit, but just in general, really fighting COVID in New York City. Really thank you on a more, I would say, financial note, to John and to Jay and James and Nicole and the entire team working with us together. As you know, we issued the financial statements a couple months ago, and we prepared, as you see in the date here, I know it's a little bit small on the screen, but I'll walk you through it. The control finding letter, management letter back in November, and really working with management and their team to make sure that first of all, we identified the control deficiencies, but working with them to rectify and correct these going forward. So really thank the entire leadership for helping us and working through us collaboratively with the process. I'll just spend a couple minutes today. I'm going to address both the grants revenue and the accounts receivable comments. And then I'm going to turn it to Sandy. I'll pause for a minute if there's any questions or any comments by Jay and the team. And then I'll turn it to Sandy to talk through the information technology comments. So as you know, in front of you is our management letter. There's 3 types of control findings. There's the most significant, which is a material weakness, which New York City Health and Hospitals does not have. So thankfully, the control environment's in a very good position. And then there's the next level, significant deficiency and control findings. Most of these in the letter today are control findings, with the exception of one, which is the level of significant deficiency, and we'll touch on that today. That's a recurring finding from the past. As an overall comment, as it relates to these financial findings, they're not, if you want to just categorize them, they're not an opportunity lost for the organization for New York City Health and Hospital, but really rather when we get into the details behind them, and hopefully you've had a chance to read the letter, they're more of accounting findings and areas of improvement and ways that we can help the institution going forward. So it's not that your financial statements were materially misstated, but this is more of an accounting finding that management's in the process of addressing. So with that being said, if you can turn it to, I think it's page 2, the grants revenue finding. So this is a repeat finding. I don't know if you want to make it a little bigger. I know it's small for me, but I have another hard copy in front of me. But this is a finding. It's a repeat finding from last year, and it really has to do with the grants department not properly applying the accrual method of accounting. So this is more of a timing issue of recognizing revenue in the proper period. The total amount was not material, approximately $4 million. And what we recommend as your external auditor is that there's better communication, or communication is enhanced between the accounting department, the finance team, and the grants management team, so that the grants can be properly recorded in the appropriate period. Okay. Now I'll move on. I know we're just going to skip down a few pages so that we can address all of IT at once. But the next comment that I want to talk about is the accounts receivable findings. I'm just scrolling down. It's patient accounts receivable, and net patient service revenue, page 6 of 8. The good news is in the past, when we started and we took over as your external auditors, we had a couple findings in this area, and they've been closed out over time. So this is the one that remains open. And again, this is a control finding, so it's not even to the level of significant deficiency, but I think it warrants attention of management and the committee. So this has to do with AR credit balances. So keep in mind, there's two types of credit balances that we're addressing here. The first is liabilities to payers, which is clearly immaterial, and I think that's really important for the committee to know. And the other relates to billing adjustments. So keep in mind the topic that we're talking about here, the credit balance, is really, as I mentioned before and preface this conversation, it's an issue within the patient's accounting system to work these balances more timely. So from a financial statement perspective, management works with reporting from a perspective to look at revenue and adjust monthly to make sure to take those credit balances back into income. So the credit balances I mentioned before that are refunds to payers, the one that really usually brings the most concern to management and the committee, it's not material, or if it is material, management has already reclassed it to a liability, or if in the event that it becomes material, management really works through those. But management has a process for estimating the credit balances to take back into income versus those are overpayments to payers. But there's just this credit balance in general. I would say this bucket of credit balances continues to rise. And we continue to recommend that management look at these on an annual basis, or actually more throughout the year, I should say, and take the proper methods and proper points going forward in terms to address these in a more timely manner. So that's what all I have from the financial statement side. I don't know, Jay, if there's any comments or any responses you'd like to address, and if not, I'll turn it over to Sandy to talk through the IT comments.
Yeah, hi, this is Jay Wyman again. Just a couple of brief remarks. I just want to reiterate what Tammy had said, that these are not material to the financial statements. In fact, the credit balances have no impact on the financial statements, but they are control areas that we are working on, trying to strengthen. These are very good recommendations. We take it to heart. I think we'll fix those going forward, and we won't have the repeat finding. So, unless there's any other questions.
I have one, Helen. This is Peniowski.
I'm sorry, who was this?
Peniowski, Peñamora. Helen, is okay?
Yes, go ahead.
Yes.
Hi, Tammy. Thank you for your presentation. Even though, as you said, this is immaterial, is there ways or recommendation that you have on how to avoid this? I know that you're trying to recommend how to process them faster, but are there any recommendations on how to avoid this type of balances, particularly for patients?
Yeah, I think that, this is, yeah, sorry, Jay, you talk what you're, sorry.
No, I was going to turn it over to Margie Carlin, who handles the accounts receivable portion to respond.
Okay.
Hi, this is Margie Carlin. So there are a number of reasons why, as Taryn had indicated, there are a number of reasons why these Tammy rather, how these occur, and we're looking within both our legacy patient accounting systems and Epic currently to look at using somewhat more automation and internal flagging to address them more on an ongoing basis. We also set up relatively recently and in close conjunction with our managed care team, a real contract and payment review process to understand and to really systematize how we look at these credit balances and address them on an ongoing basis. So we, while I don't know if Grant Thornton has very specific recommendations for us, we really are looking at industry standard practices and implementing them across the board, both on the managed care and revenue cycle side.
Oh, thank you, because I think this is very important. I know that maybe a small amount in the overall budget for us, but you can imagine for a patient, it could be significant if they have overpaid. So I think it's good that you're taking a proactive step to try to process these kind of credits as quickly as possible to the patients. Thank you.
Okay.
And Jay, I think you have in your plans to present back to the audit committee an update on how we're doing on this process, right? Jay?
I'm sorry, Heather, I didn't hear the question.
Sorry, I'm a little far. No, from the last conversations, you do have in your plans to update the board and the committee on how we're doing on this project, correct? You have it in your timeline?
Yeah, what I think, what we'll do is, halfway through the year, so, in this case, our May meeting, we'll update the committee on the progress of all the findings. There's 3 basic findings, Tammy just went through 2 of them, and we'll update the committee on our progress.
Great. Okay. So if there's no other questions on, I would say, more the financial statement side, I'm just going to turn it to Sandy to spend a couple minutes on the information technology side.
Thank you, Tammy, and good morning, everyone. I'm Sandy Pabla, and I'll be providing the IT audit update. As a result of our review this year, one minor control deficiency related to user access reviews was identified to help enhance the overall IT environment. We worked with Jonathan Goffin as well as the rest of the IT team, and will continue to do so in order to ensure this is addressed in a timely manner. The good news is that the remaining items summarized on pages 3 to 5, which were noted in fiscal year 19, have been addressed and subsequently remediated for fiscal year 20. Any questions specific to IT? Great. And with that, I guess I'll turn it back to Tammy.
Great. Well, I have no other further comments. I don't know, Jay and the team or Helen, if there's anything else that you have from Grant Thornton as part of the agenda that you'd like us to talk through
Board
today.
members to see if they have any questions. Dr. Pagan, do you have any questions?
No, just to say thank you for all the work and that's about it. Happy 2021.
Dr. Katz?
I think it's been a very successful engagement, and thank you very much.
Penny?
No, thank you. I don't have any questions.
Sally?
No questions, thank you.
And I just want to thank you, Tammy, and the rest of the Grant Thornton team. Once again, you guys made it work through the pandemic, and thank you for being so flexible with us as well and making the whole team. And Jay, what can I say about your team? You guys make the magic happen no matter what. So we're very grateful as a board.
Thank you.
So next we have on our audit, we have an audit update from Chris Delano. Chris?
Thank you, Helen. Good morning, everyone. I will start on page 3 of my briefing to discuss an audit conducted by the New York City Controller's Office of the Oversight of Auxiliaries. The notification letter for this audit was received in March 2020. However, due to the pandemic, the audit did not begin until June 2020. It is being done remotely. Thus far, the audit has consisted of meeting with relevant corporate personnel and individuals from 3 hospitals and requesting documents related to the operations of the auxiliaries. While the audit is ongoing, we have not heard from the auditors since early November. Our only interaction since then has been internal audits sending them the auxiliary reports listed on page 9 of this document that were completed by the external CPA firm. Moving on to page 4, this audit is also done by the New York City Controller's Office. It's of controls of nursing homes. The audit began in August 2020 and is also being done remotely. The auditors have had meetings with the Senior Vice President of Post-Acute Care and the CEOs of the 5 nursing homes within the system. Documents have been requested from the Senior Vice President of Post-Acute Care. internal audits, has assisted with the scheduling and has participated in all meetings and reviewed the documents requested by the Controller's Office prior to submission. Moving on to page 5. This is a summary of internal audit's review of year-end inventory. The objective of this review was to verify the existence of the 90-day supply of personal protective equipment that was required to be held per New York State mandates. Verifying existence is an accounting assertion that should be tested to ensure financial records are accurate. As of June 30th, 2020, general ledger inventory balances showed that more than $80 million in medical supplies, primarily PPE, was being held by outside vendors. The entire internal audit staff visited the warehouse of these vendors to not only confirm existence, but also to evaluate the controls and security provided by the vendors. It should be noted that the general ledger balances were a result of corporate finance recording the inventory at the vendor sites as an asset upon receipt of the total inventory value from corporate supply chain services. This was done because the inventory was not captured on the Health and Hospitals perpetual inventory system at year end. Two of the vendors we visited were Crothall Healthcare, located on Long Island, and 2 Iron Mountain warehouses located in Jersey City, New Jersey. Crothall held for New York City Health and Hospitals over $16 million of ventilators and other equipment at their warehouse. The warehouse was well organized and secured. Our count of 15 of the 19 items held revealed only nominal discrepancies that are discussed on page 6. We also noted an error totaling $328,000 in the spreadsheet provided to finance of the inventory held at this site. Turning to page 7, our visit to 2 of the 3 Iron Mountain warehouses is discussed. Once again, we found the warehouses clean and organized. Minimal discrepancies were noted during our counts. As of June 30th, Iron Mountain was holding over $55 million in medical supplies for health and hospitals. Per the table on page 7, the inventory being held had increased upon our review in September. Moving on to page 9, the CPA firm, Bonadio, who was hired in June 2020 to evaluate the financial statements of the auxiliaries, has been issuing many reports in accordance with New York State Charities Bureau regulations. The type of reports being issued is based on the revenue of the auxiliary. Revenues under $250,000 require a compilation. Over $750,000 require a complete audit, and between $250,000 and $750,000 require a review. Thus far, reports for 13 of the 22 auxiliaries have been issued. 8 of the 13 reports required evaluations of 2 years. Overall, 8 compilations, 4 reviews, and 1 audit has been completed. No internal control weakness or management letter comments have been found. Internal audits coordinates the auxiliaries between Bonadio and the auxiliaries, and reviews the draft reports and issues the final reports. And if there's not any question, that concludes my presentation.
Any of the committee members have any questions?
Hi, Helen, it's Frida. How are you?
Oh, hi, Frida.
Thank you. I have just one quick question on the comment regarding the review of the inventory, and that's regarding the difference in the general ledger balance and the inventory. And could you just explain that? What is the perpetual inventory system, and what's the ramification of that there was a discrepancy there, Chris?
What I had mentioned was that the inventory at the warehouses were not included on our inventory system. And the inventory system is a PeopleSoft perpetual inventory system that records the purchases and the distributions of the inventory, medical and surgical inventory that is held at the facilities.
Okay.
And they have a warehouse, which is called Central Stores, and they maintain inventory to distribute to the different departments within the hospital. These vendors were holding PPE for us as required by New York State regulations, and that inventory was not included on our system as of June 30th, 2020. And as a result, it was expensed. They flipped the expense to an asset.
I see.
To properly record it.
Okay.
Does that answer the question?
Yeah.
Okay.
Jay, you want to chip in on that?
Yeah, I just want to add, and the inventory systems are set up at the facilities. They aren't set up in central office. So when those were purchased, the only way that they could record it is as an expense. So it wasn't like they did something wrong. It was just something that, in order to purchase it, they recorded as an expense. My office goes through this routinely and reclasses it to inventory, which is the proper use of this, and it is an asset and hasn't been used.
Right.
So that is, that's how we get it onto the general ledger, and therefore, the financial statements. This year was unique because of COVID. Usually my staff will assist in the accounts, and they didn't this year. So we did rely on the accounts in order to record on the general ledger, and that's where the difference was between what was on the, what was placed into inventory and what the actual accounts were.
Okay. That's very helpful. Thank you. And then one other just question, Chris. I think the findings are all very good, that everything seemed very in order and what we expected. One question I did have is, you talked about some of the inputting into the systems maybe being in error or things like that. And so you referenced the 240 N95 masks that were actually disposable protective face masks. And while I don't think that that's a significant issue here, just questioning, we found that in an audit, if we weren't auditing that typically, if there were other mistakes, what kinds of checks and balances or sort of best practices are there to try to ensure that there isn't an error in what we think we have?
There are periodic counts to make sure that what's on hand does agree to the inventory records at the warehouses, at the hospitals, and the warehouses we visited. They were also doing periodic counts to ensure that the records were updated and provided to corporate supply chain services.
Okay. So there are just once it's recorded, it's not just forgotten and lost. There's periodic checks and updates.
No.
Right.
Not at all.
Okay. Terrific. Thank you.
You're welcome.
Helen, I have a question.
Penny?
Thank you, Helen. Again, thank you for sharing with us this information about the audits. My questions are related to the COVID equipment, supplies that were either donated or bought. We know that we have read some newspaper article looking after how the CAS distributed those donations and looking at the audit of how those were kind of managed. Did we do any special audit for those type of equipment and materials? Or are these being lumped within these annual audits that we regularly do?
What type of equipment are you referring to?
The ventilators, all the equipment that were deployed during COVID, the height of COVID. and that were either donated or provided by the state or by different institutions, as well as the PPE materials and all that. I'm just asking if there was any special audit to track those type of search on equipment and materials that were bought or donated.
No audit was done at the time of the surge. We decided to look at the inventory that's being held, the excess inventory that's being held. In this particular case, it was by Crothall, and they were holding the ventilators. And we went there and we saw that everything was very well secured and controlled, and their records were immaculate. So we were very impressed with that the equipment being put aside for the current surge or even future surge is well controlled.
Okay. Well, I think that's helpful, but maybe, I don't know, since people always like to go back and guess how people should have done things during a crisis, and it's never accurate. The more I think we have our documentation, I know that we are right now in a second surge plus managing the vaccination, but if at any time we have the resources to ensure that if anybody were to ask any questions, we can respond easily, I think that may be something that could be explored.
Okay.
And I also think, Chris, and correct me if I'm wrong, but anyone that requests any of these PPE items from the warehouse, all of that is tracked, right? There's like a form, there's a whole process in place, correct?
Yes, that's the usual procedure, is that forms are completed, requisition forms are completed and sent down to the warehouses at the facilities, and then it's delivered, signed off, and removed from the perpetual inventory system held by the central stores, and then it's expensed to the department that it is distributed to. So yes, there is paperwork, there is controls.
Are there any other questions from the committee members? If not, next we'll go to the next agenda item, where we're going to hear from Catherine Passos, a compliance update. Ms. Passos?
Okay, good morning, everyone.
I'm sorry, ma'am, what is your name?
Catherine Patsos, Chief Corporate Compliance Officer. Okay, so as required by federal and state regulations, the Office of Corporate Compliance does a monthly screening of sanctions lists from the federal and state level. And from September 24 to December 22nd, there were no workforce members, vendors, or agency nurses who were excluded from any federal healthcare program. We had one community physician who was excluded from several lists, and however, that physician did not have any active orders with community care and was removed from being chosen as a provider in Epic. We also checked the Death Master file and the National Plan and Provider Enumeration System. And as stated in paragraph 5, there were no providers identified on either of those lists. Moving on to the privacy incidents and breach report, as noted in paragraph 8, there were 32 incidents that we recorded in our tracking system that were HIPAA incidents. Of those 32, we found that 22 were violations of our HIPAA privacy and security operating procedures. 5 were found not to be a violation, and 5 are still under investigation. Sorry, this is going too fast. Of the 9 that were determined to be breaches, 3 involved the providing an after visit summary to the wrong patient. 2 involved mailing patients with PHI on the envelope. In one case, a provider disclosed a patient's HIV status while the patient's father was in the room. Another involved an employee who accessed an employee patient's medical record without justification. Also, we had a patient information was entered into another patient's MyChart account. One instance where an employee accessed a patient's messaging application and engaged in a conversation about the patient with an unauthorized individual. The individuals who were responsible for these breaches were counseled and received HIPAA remediation training, except for the person who entered the wrong information into the MyChart account. That individual was a temporary employee and is no longer with New York City Health and Hospitals. Let's see, we can go to the next page. I apologize. This is, okay. Page 3, paragraph 10. We did not receive any reports from the Office for Civil Rights during the reporting period. Moving on to paragraph 11. For the reporting period September 24 to December 22nd, we received 79 compliance reports. None of them were considered priority A, 23 were priority B, and 56 were priority C. And the breakdown is on the following pages. If we move on to page 8, in paragraph 12, this is an update on what's been happening with HHC ACO. On October 8th, they completed gathering input from the Geriatrics Council on clinical content that will be in the proposed annual wellness visit Epic Express Lane template. And on October 15th, that template was presented to ambulatory care leadership. This template is a documentation and ordering template that allows a provider to quickly complete a patient encounter because all the components of the visit can be easily found on the screen or in the Epic tab. These templates are fully customizable to include whatever information is deemed to be necessary. And moving on to page 9. So the HHC ACO plans to use this template for the Medicare annual wellness visits, which are annual comprehensive visits for Medicare patients. And currently this template exists in Epic with just a generic content, but HHC ACO plans to build out the content, including order sets, documentation requirements, billing codes, risk screening questionnaires, and so on. And this is to better align with our ambulatory care leadership goals and to serve the geriatric population better. HHC ACO also worked with the Geriatric Council to create the clinical standards of the annual wellness visit express lane template. Moving on to paragraph 15. On December 15th, the HHC ACO held the first of its 2-part annual quality review process webinar training sessions for payment year 2020. And they are required to manually report chart review data for 10 of the Medicare Shared Savings Program quality metrics. This webinar trains chart auditors that are representing each of our facilities and the Gotham facilities. The external partners on how to perform the quality review process and documentation requirements for each of these metrics. The second part of this webinar training was conducted on December 29th. Moving on to paragraph 16, as previously reported, New York City Health and Hospitals engages a vendor Coalfire to conduct our enterprise-wide risk analysis of all of our facilities. Moving on to page 10, paragraph 18, at the end of 2019, Coalfire provided us with compliance and security workbooks and a risk management plan, which identifies the high and very high risks that are based on the risk analysis. These risks are being mitigated and assigned to appropriate individuals to implement the mitigation plans. Those are tracked by our governance, risk, and compliance tool to get their progress and monitor how they are coming to completion. COFAR completed its second year 2020 risk analysis engagement, and they completed the workbooks and reports in November. The final risk management plan is going through final review. On December 2nd, the Office of Corporate Compliance distributed COFAR's risk analysis and compliance reports for the facilities to the leadership of each facility for their review and to know what the risks that were identified are. And COFAR will meet with system leadership this month to discuss the results of the enterprise and facility-specific risk analyses and compliance reports, as well as the risk management plan. Moving on to page 11. As part of our compliance program and required by social services law, the Office of Corporate Compliance developed a risk assessment for fiscal year 2021. And that identifies the risks that pose a legal, financial, or reputational risk to the organization. On September 12th, this risk assessment was presented to the Executive Compliance Work Group to analyze and provide their input. And based on their input, they determined which of the risks in that draft risk assessment should be included in the FY 2021 Corporate Compliance Work Plan. On November 30th, the ECW met to finalize the Corporate Compliance Work Plan for fiscal year 2021, and that will be presented to the Audit Committee today for approval. Finally, in paragraph 24, also as part of our compliance program, we provide compliance and HIPAA training to all workforce members. And so far, the overall completion rate for 2020 for employees is 87%, with most of facilities and departments reporting over 90%. 69% of non-employees completed the training. However, we are still waiting for confirmation of training attendance by many non-employees. And the completion rate in most facilities and departments was more than 80% for non-employees. That concludes my report. If there are any questions.
Are there any questions from the committee members? Okay, hearing none. I will call now a motion to convene in an executive session to discuss confidential and privileged matter that might be related or anticipated or actual litigation, as well as certain personnel matters. Can someone second?
Danioski, second it.
Thank you. Now I'm gonna, Dr. Pagan,
Yes.
Dr. Katz, Penny,
Yes.
Frida,
Yes.
Sally, okay, now we're convening into executive session. Only those that are specifically invited to remain in the boardroom or online, please stay. All those, please sign up. So everybody.
Have a good day, everybody.
Thank you so much. Have a great 2021.
Thanks. Bye-bye.
Thank you.
But I can ask you the question later, Helen.